my name is Lee. I'm a respiratory therapy student at Parkland College, and today I'm going to be doing my video competency for artificial airway inline suction catheter. Suctioning. I can't talk. Not making any sense. Before I enter the patient's room, I have reviewed the patient charts, verified the orders. All my equipment is already set up, being as it's an inline catheter. I have done hand hygiene and put on my gloves. And I'm going to go ahead and enter the patient's room. Hi, my name is Lee. I'm a respiratory therapy student. So I'm going to be taking care of you today. I'm going to verify your name and date of birth with your armband. All right. So we're going to get you suctioned out here and make sure we get all those secretions out of your endotracheal tube, okay? So the inline suction catheter is the correct size for the ET tube. The ET tube is a size 7 and it is at 28 at the lip in the middle. So I will have all that stuff to document later when I get back to his chart. I will listen to the patient's breath sounds, do all the vital signs, check any make sure nothing's out of order, his chest movement and rise, and do the pre-assessments. I will go ahead and set up my suction. Make sure I get all that set up, and then I want to set it between 120 and 150 for the adult. So I'm going to set it right at about 150. Before I suction the patient, I'm going to hyperoxygenate him for about 30 to 60 seconds with 100% FiO2, just to make sure we don't have any complications while we're doing the suctioning. I am going to open up the lock so that way whenever I go in, all I've got to do is push it down. I'm going to stabilize the endotracheal tube, go in fast until I get to where I meet some resistance and pull back about 1 to 2 centimeters, and then I'm going to start suctioning nice and slow, keeping it under 15 seconds. Make sure I get the catheter pulled all the way out of the airway, and then I'm going to go ahead and lock that back up. I will turn my suction off. I will double check the placement of the tubing. If the patient needs it again, I will go ahead and hyperoxygenate also, just to keep his vital signs up. Then I would reassess him. I'd do his vital signs and his breath sounds, make sure everything is looking okay before I would leave the room. Then I would write everything down in his chart, his placement, his tubing, what I did for him today. And then I would remove my gloves and do hand hygiene before I exit the patient's room. There was a lot of